Hello, I'm Dr. Jay Greenspan. Many families have questions about gluten and the gluten-free diet and whether it's healthy or not. Joining us today on our chat is Jackie Costantino, who's a registered dietitian here at Nemours. Welcome, Jackie.
Thank you.
And of course, Paul Rosen is joining me as well. Hi, Paul.
Hello, Jay.
So, Jackie, who is the gluten-free diet for and who is it not for?
A gluten-free diet is appropriate for those who have celiac disease, which is an autoimmune disease where the immune system attacks normal tissue, specifically in the small intestine, and it's in response to gluten. It's also appropriate for those who have dermatitis herpetiformis, which is a form of celiac disease that manifests through the skin. And it's intense burning and itchy rash of blisters and bumps, which affects about 15 to 20% of people with celiac. Also, gluten ataxia, which is an immune-mediated disease of poor coordination and unsteadiness due to brain's failure to regulate the body's posture and regulate strength and direction of limb movements. And then also non-celiac gluten sensitivity, which is the symptoms of celiac disease but without the intestinal damage. It also may be helpful for those with IBS. There is recent research showing improvement in symptoms. However, there is more research that needs to be done to kind of understand if it's really the gluten or maybe it's another factor.
And the IBS stands for?
Irritable bowel syndrome.
Okay. So it sounds like it's relatively commonly needed, or are these relatively rare problems?
They're relatively rare problems. So who it's not for is anybody who doesn't have any of these diseases. And the popularity of this diet is increasing. It's not appropriate for those who need to lose weight, want to eat healthier, who have type 1 diabetes, or have autism spectrum disorder. Also, some people with a wheat allergy believe they need to have a gluten-free diet, but the gluten-free diet is more restrictive than a wheat allergy. They just need to exclude the wheat, whereas they can have the barley and rye that also have the gluten in it.
I have some patients where the child has some stomach problems and they get tested for celiac disease. The test comes back normal, and then the family goes ahead and tries them off gluten. Mm-hmm. And then sometimes there's a report that the child's improved. Would that patient be considered as having a gluten sensitivity then?
Yes, exactly. So before you're sensitive to gluten, the doctor would roll out celiac disease or some of those other conditions that we talked about earlier. And then once they roll those out, then you can cut the gluten out of your diet. And if you have symptom improvement, then you will know that you're sensitive to gluten. But you don't want to cut it out before you're tested for celiac disease, because once you cut it out, they won't be able to diagnose celiac disease.
If you don't need a gluten-free diet for a medical condition, is it harmful to be on a gluten-free diet?
It can be, because gluten-free alternatives are not healthier substitutes. They're usually made with potato, rice, and corn starches as alternatives, and the products are usually higher in calories, fat, saturated fat, and or starches to compensate for the change in taste and texture. They're also lower in vitamins and minerals, fiber, and whole grains, and they're often not fortified. So if it's not followed carefully, it can be a healthful diet, but if it's not followed carefully, it really can cause nutritional deficits.
So that's really news to me, because many people say, yeah, I'm going to go gluten-free because I want to be healthier. That's probably not the best advice.
Yeah, probably not the best advice. There definitely has been this idea around gluten being bad for us. I'm not exactly sure where it comes from, but the general population has kind of jumped onto that trend. And I don't know if it's because, it's free of a component, which is similar to a sugar-free product or a fat-free product. This idea that we just want to take things out of our foods. But the food industry, they've known about this. So in response, they've either made their food gluten-free or have a gluten-free alternative. And then if their food is actually naturally gluten-free or already gluten-free, it's really being advertised and kind of put in our faces. So we think that's a good thing.
Jackie, I do have patients who reach for a gluten-free diet for other reasons. So their child has an autoimmune disease, and I get the question a lot, will a gluten-free diet help with arthritis or some other condition?
Right.
And what do you recommend we tell them?
The research on those conditions is actually inconclusive. So a lot of it is based on testimonial. Not to say that it might not help, it's just that we don't really have concrete evidence showing that. It's a pretty restrictive diet. Without the research, we wouldn't recommend starting that restrictive diet.
And if a parent is considering a gluten-free diet for their child, would you recommend they touch base with a registered dietitian first before going down that road?
Definitely, yes. Because like I said, it could be restrictive and definitely needs careful planning to make sure that it's well balanced.
So this has been great information and learning for me. Most people, I think of a gluten-free diet as a diet. I'm going to lose weight on that. That seems not to be the case.
No, like I said, it could be higher in calories actually. So unless they're going to cut out a lot of processed foods and start eating more fruits and vegetables and fresh meat, if in taking out gluten, they then have a healthier diet, that could make them lose weight. But just gluten-free products in general are not going to help lose weight.
So the take-home message from this, Jackie, has been if you need gluten-free, it should be probably diagnosed by someone, a doctor or a provider or a nutritionist, a dietitian. And other than that, probably not necessary to go on one. A gluten-free diet is probably not a good idea. It may even be harmful. Is that a good conclusion?
Yes, that is a good conclusion, yeah. If a parent wants to put their child or their family on a gluten-free diet, just would like them to know the facts and really think about if that's the best choice for them.
And Jackie, when there's a family that does have a child with celiac disease, does that family cook gluten-free for everyone, or do they make a special dish for that one child? Or?
That's a really good point because the need for gluten-free food has increased. Celiac disease has increased. But, for that one person in the family, if they're gluten-free, they're probably cooking gluten-free for the whole family. So that is more people on a gluten-free diet just because it's simply easier. I wouldn't say one is more than the other. It's probably going to be individualized based on each family's preference. But if it were my family, I think that it probably would be easier to just make one dinner that's gluten-free for the whole family. Mm-hmm.
And probably not much harm for the other kids in the family to do that.
You know what? If they have celiac disease and they are following a gluten-free diet, they likely are meeting with a dietitian and they've gotten extensive counseling and they know how to make it a really nutritious diet.
Great. So don't take this on alone. There's help out there from people like you.
Exactly.
Thanks so much for joining us, Jackie.
Oh, you're welcome. Thank you.
To our listeners, if you have a question about this topic, or if there's another topic you'd like us to explore in a future pediatric chat, you can send it to us by using the question portal on our webpage. And be sure to view our library for more pediatric chat programs. I'm Dr. Jay Greenspan, and thanks for listening.